Right. Well, let's go ahead and get started. We've got some great stuff today. So as you all know, California Bridge is a program of the Public Health Institute. We are funded through the Department of Healthcare Services. We have no financial disclosures, although we may use brand names or generic drug names interchangeably, but that doesn't necessarily mean we're promoting a specific branded drug. So California Bridge, our goal is to have high access care to high quality treatment for substance use disorder in all California hospitals by 2025. And we are well on our way to that. All of you are part of this movement. We're so, so glad that you're able to join us for this specific presentation, which is where we're going to hear from, some of our nurse leaders through California. We all know the impact that a navigator can have on the emergency department, on the hospital, and patients' lives. But today we're going to talk with some nurse leaders and how the navigator has improved and impacted their hospital. So with that, I would love to introduce our panelists. And let's kick it off, Becca.
Good morning, everyone. My name is Becca Denoeu. I am the Director of Emergency Services and Respiratory Care at Adventist Health Ukiah Valley up in Southern California, Ukiah.
Thank you, Becca. Chelsey. Oh, you're on mute.
The primary rule. Sorry about that. Good morning, everyone, and thanks for joining us. My name is Chelsey Shanks. I'm the Director of the Emergency Department at Marshall Hospital in Placerville, California.
Thanks, Chelsey. Nicole.
Hi, good morning, everybody. I'm also from Marshall in Placerville, California. I'm lucky enough to work with Chelsey. I'm our Executive Director of Specialty Nursing Services. So I have specialty departments, and the ER is one of those great teams here at Marshall.
Wonderful. Thank you all for joining us today. So as I mentioned, a navigator is a major component of the California Bridge program. The substance use navigator or patient navigator supports patients with the substance use disorder treatment, during their ED visits and assists to link them to treatment. And our data shows that the navigator positively impacts those patient outcomes and experiences. But I'd really love to talk about, the role the navigator has in your specific hospital. Could you speak to some of the benefits of the patient navigator role and how it has impacted the care and outcome in your respective areas? Becca, can you kick us off?
Yeah, the ways are numerous. I would say our substance use navigator in Ukiah has made a huge impact on staff, providers, and community life, as well as addressing the gap that was there between the ER visits for patients with substance use disorder and connecting them with outside services such as your MAP program, rehab, any of those areas that are needed. And we have been able, over the past few years, to really integrate our substance use navigator. And they are a huge crutch for all of ER nursing these days. We have seen a very big amount of success over it's been a total of 3 years now. Just this year alone, we had over 700 substance use referrals to the ER with over 300 connections to our local MAP program. So huge successes for a yearly ER volume of 30,000. I mean, it kind of speaks volumes for what's happening for the patients in the moment and then continuing for discharge.
Wow, that's really impressive. Those are some amazing numbers. Nicely done. I'm glad that that's working well for you all. Chelsey, same question for you. How are things going?
Oh, it's wonderful. I mean, we could talk, it's a 30-minute webinar, but we could talk for hours about the benefits of the substance use navigator. In addition to the help that she provides our patients, linking them to substance use disorder treatment, we've seen these benefits overflow into different patient populations. And our navigator specifically has become very involved in bridging some of the gaps and linking our patients to community resources for our mental health patients as well. We've also seen an improvement in cultural relations with our social worker and how they work within the emergency department. And it just, in general, relationships have improved, and our ability to soft hand off patients into a community resources is just so enhanced with the role of substance use navigator. She's also very involved in discharge planning. She has a great mindset about thinking about discharge as soon as someone gets into the emergency department, which is a cornerstone of emergency departments. You want to always be thinking about what we're going to be doing for the patient on the back end. And so our navigator has been instrumental in helping create some resource tools that we've actually been able to train some of our nursing staff to be able to utilize. So she's created resources within the department that lists clearly the process and the insurance, how to navigate insurance, and all kinds of things that have helped the nurses also be able to link these patients to support on the outside of the ED.
Fantastic. I love hearing how the navigator can help just the department sort of work better, just a little bit more cohesively, and I know that at times navigators can, support in ways that social work can, but I'm really glad to hear that that's been something that's helped the social work team as well, support them do their work better.
Something else that's been really neat, it's been so successful in the emergency department that our navigator actually now is working with our med surge and telemetry units and our labor and delivery as well, meeting patients there and facilitating linkage to community resources on the inpatient side as well.
That's fantastic. We love to hear that. We love to hear the impact of the navigator being so powerful in the emergency department that we can bring them into other areas of the hospital. We know that this role is so important and can make a difference for so many patients' lives. Yeah, these are all great examples of, the established benefits of a patient navigator and that improvement for care coordination, discharge planning. But I'm curious about if there's some less obvious or less talked about options or ways that you see the navigator helping drive value. Maybe there's an impact or an outcome that surprised you that hasn't gotten much attention. Could you share where maybe you've seen navigators making a unique impact that might not be at the top of mind, but are still meaningful? Nicole?
Yeah, so I'm sure many of you nurse leaders are familiar with our new Joint Commission standards that started January 1st of this year. So that's LD, I wrote it down so I would remember, that's the LD 030408 EP3, which talks about collecting data. The whole Joint Commission focus for this new regulation is about that there's an expectation for hospitals to be working on equity and that we're trying to work towards closing the gap in disparities in healthcare. We know that this is a huge issue in healthcare, but what's so amazing about the ED Bridge program is that it comes with an enormous amount of data. And so that's from the very beginning of the program. It's been very, very good at collecting the data so that we can see the value of the program. But another piece of the value that we find is that it actually allows us to meet these regulatory requirements. And so it was really great when our director of population health reached out and said, oh my goodness, I just looked at all this data that you guys have been collecting. This is perfect and aligns perfectly with what Joint Commission wants to see us doing. And so we're meeting a brand new regulation without even knowing it.
I'd love to hear that. That's amazing. We have the navigators doing work, collecting data, impacting patients' lives, but that's fantastic that you all were already meeting that regulation without even really having to do much more than the amazing work your team's already doing. And having that data ready instead of having to do a big data, retrospective is very valuable.
Well, and it's also so clearly valuable to our patients and to our team, which I know we'll continue to talk about. So it isn't just like a check the box. It's really being able to quantify the value that the program brings in a real way without just like, oh, let's just add one more thing to make Joint Commission happy. It's actually doing something very meaningful.
Yeah, absolutely. Becca, I know you've got some stuff to share here. Your connection's a little bit rough on the audio. Could you maybe just slow down a little bit while you're speaking? That should help.
A lifelong problem. I will do my best.
Thank you. That's better.
Yeah, I just kind of wanted to follow up with what Nicole was saying. We saw the same benefit with our data, as well as we learned we're on the journey to go from a level 4 to a level 3 trauma center. And part of the ACS requirements is having that SUN resource. And it's really nice to already have it so hardwired and embedded and seeing the outcomes and the resource, whether it be ER or inpatient, to meet requirements for many programs that benefit not only us, but our patients in the community alike.
Yeah, that's such a good thing. I hadn't even considered that, but the different ways that having that requirement already in place can help with those different certifications. A really interesting angle. Yeah, thank you. Well, I'd love to get to the meat of this, is how do navigators really impact the nursing staff? We sort of touched on, we know the impact they have on patients. We've touched on, the support that they can provide for social work and discharge and supporting other units. But let's talk about the nursing staff. How have navigators helped, made things easier and more efficient for the team? Nicole.
I would love to speak on this topic. I've actually been with California Bridge. This is my last organization that I used to work at. Also was with California Bridge. And so when I first formed a relationship with Bridge and started this program in my ER, I was an ER manager. And I would say this was the most profound impact that I had, was seeing the change in culture of my team and having the ability to now have something that we can provide patients who are clearly suffering. We see so much suffering in the emergency department across the board, and it's painful. It's painful to watch so much suffering, but it's especially painful when you feel helpless and don't feel like you have the pathway or the tools that are actually going to be meaningful in someone's life going forward. And we never had that. I've been a nurse for 20 years now, and I can think of multiple patients that I just remember wanting to help but not having the tools to help. And the Bridge program brings this set of tools and this new approach to a longstanding concern that nurses have that moral, that moral injury, and that leads to compassion fatigue when you don't feel like you have the ability to have a lasting impact in someone's life and be able to have the tools to help them. And so what I was really loved about the program is being able to see the shift in the culture and seeing the nurses say, it was never okay to say this, but without having the tools and with having the compassion fatigue, people were saying things like, they don't belong in our ER, why are these people here? But when you shift the culture to, this is exactly where they belong, and here's what we're going to offer you to be able to support them, and you're going to actually, next time you see them, they're going to, have really had a lasting impact because of the connections that we're going to be able to make for them in the community. That takes a huge amount of moral injury out of the picture for our nurses. And so what we also did when I came down to this facility, because I had seen that amazing cultural shift, is that we developed a training, and I certainly can't take credit for it. It was our amazing substance use navigator and some of our other great leaders in the department put together a stigma training, and we made it mandatory. And so everyone in the emergency department had to go through it. It was called People First. It was a beautiful program, and it really just aims to change the hearts of people and see understand what people are really struggling with, and just bring about like the heart piece of it, and then understand how helpful these pathways can be for people. And so that was really amazing. And I think Chelsey and I both saw a huge cultural shift after we rolled that program out.
Thank you, Nicole. You touched on so many good topics there. I think, or points there. Nurses, people go into nursing because they want to make a difference in people's lives and they want to help people. And it's a really hard profession. It's really demanding physically, emotionally, spiritually. There's so much that is asked on every shift, and to be present with patients and emotionally available to them as best as you can to support them through their journey. And I'd like to believe that we all can, retain a certain amount of heart with us, but it's exhausting, and, compassion fatigue and burnout happen. And I'm really glad to hear that this impact of the navigator has had on your team has been so significant. This resource that we put in the chat, that the People First Team Approach to Stigma Reduction, this is a beautiful resource. It can be adapted, almost to any unit. It could even make it work for your hospital, share it with your teams. It's really, really powerful. Yeah. Chelsey.
Amy, when we did the People First training for the emergency department, it was an absolutely palpable shift culturally within the department. And it touches on the physiology of addiction, and it has such a compassionate approach that you could literally see the mindsets of our staff change. And it's been really neat to watch. Our navigator is all over the department. She's meeting people in triage. She's, in the back in the recess rooms. And she just does a phenomenal job of role modeling, meeting people where they're at, And that approach has really been, it's been adopted by a lot of our staff who have gone through the training, who are working alongside our navigator. And it's just been really neat to watch that kind of snowball effect of the approach we have for our patients. That kind of approach to communication, and it's just not taught in nursing school.
Yeah.
And so that's just another benefit that our navigator has really brought to the department, is just really just being so helpful and bringing compassion into the conversation, and how far that can go with building trust with our patients, and then, you know, our ability to help them.
Yeah, that's huge. And you're right, you know, this isn't taught in nursing school. You know, even in nursing school, they tell you, you know, this is what you're being taught here. We acknowledge it won't be how it is in the real world. And then you get out into the real world, and depending on your shift, you know, the tone could be set by a nurse who's been on the unit for 20 plus years and is on their way towards retirement, and, you know, maybe has different feelings about things, or is more or less open to education about the shift. So I'm really like, I love hearing this impact, you know, for the patients, but also just for like the heart and soul of the nurses who are doing this work, and their quality of existence and being able to care for patients in that way. Becca, I know your nursing team has benefited as well. Love to hear from you.
Yeah, I think it comes, we didn't even know what we didn't know. I kind of feel like that's the premise of nursing in general and the ER life. You wait for anything to come in, and as Chelsey said, you always have a plan. Where are they going? Are this patient being admitted or discharged or transferred? So this patient population, we often didn't have a plan, not even a bad plan. We just had no plan. And so a few years ago when this was brought to us, I didn't know to be in favor of having a Sun Navigator or not, because I didn't know what that looked like. We got very blessed in Ukiah and in our other sister hospitals in our county with 3 very dedicated substance use navigators that piloted this program and really grew us with the program. And so we have developed a relationship from the beginning. And now I will say, I don't know what we would do without them. When they go on vacation, someone covers. They have a very great group that just keeps everything flowing. But this program started on a grant for Ukiah. And when that grant was set to go away, I will tell you very openly is that the entire ER fought very hard to say, I don't care if we lose a nurse. We cannot lose our substance use navigator. And we're very blessed with a very direct open door to our executive team who supported this. And now this is a hospital position, we're not counting on a grant or relying on a grant. So really important thing to go from, I don't know what this person does, to I don't know how I would do my daily job without them. I love that. They keep us in line. The other thing they do is when patients are coming in, they know our patients now. They're like, oh, here comes so-and-so. Let me get in there with you, such as I believe Chelsey said, a triage. They know who they're going to connect with, and they have a plan. And that is the most impactful thing for anybody working in healthcare. What is the plan? You know, what are we going to do to make sure this patient is okay? Because that is a feeling that leads to burnout and fatigue when you feel like you're not completing the care, you're giving poor care, or you're not meeting the patient's needs. So I would say the impact in our department mimics everybody on this call. We have changed. I don't want to say we've taken away the stigma. We've not done that. There are parts that are still there. We've addressed that it's there. We acknowledge that it's okay to not understand or to not be okay. And our Sun Navigators are there to help us with those patients or through those hard moments. So the patient gets what they need, and we can support that patient and not have that stigma associated as you don't belong in our ER. So that is not acceptable. It's just not. The ER is the place for anybody to go anytime.
I think Amy might be frozen. Hopefully she'll log on here in a minute, but I just want to add on to what Becca and Chelsey both said. You guys said it so beautifully. I feel what I love about the program too is that when you can learn to, the stigma program, it's such the people who use drugs, the stigma against people who use drugs is so deeply woven into our society that if you can address that stigmas start to fall away as well. And so what I've noticed is, yes, the program may be focused on people who use drugs, but you start to see the love and the compassion just spread to people, because it's really just about loving people wherever they are, whatever the stigma is or not. Looks like Amy's back.
Yeah, sorry about that. Gotta love a, mid-morning internet snafu. So yeah, I missed part of that, but I'm happy to come in at the end. Yeah, you're making, it's about people. We are all people. And, we've talked about substance use disorders, like, a person is a person first. A behavior can be changed. And, all of your nurses being supported by your navigators really significantly impact that. I know we just put another link in the chat. This is to another resource. This is a culture of care, and this is some of the things we've talked about today. So I want to make sure that those of you who are following along have an opportunity to take a look at that. I want to give a pause and see if there's any questions or comments. Does anyone have a question for us in the chat? We've got a little bit more time today, and I want to make sure that if there are any questions, we have a moment to answer those. So let's just give it one moment here for that. And Becca, I know that one thing that you mentioned to me that I found really impactful when we were doing our initial sort of conversation about this is you mentioned a specific scenario about the impact that your navigators had on naloxone out into your community. Wondering if my connection is kind of cutting out here and you're having a hard time hearing me. Okay.
A little bit.
Well, let's give it a second. Apologies. All right.
I think I know what Amy is. If I can, we implemented through the ER program where anybody can give anyone the intranasal Narcan that we keep in the emergency room. It's not through the pharmacy. It's not with the doctor's orders. We can give it out very freely. And we've seen it repeatedly given out hundreds per month of doses. I believe, I wish I knew specifically, we are number 1 or number 2 in the state of California for the number of overdoses per population per capita. So we've taken a really big stance on acknowledging that it is there and it is out. And we had an interesting case come in. Our patient came in unresponsive and was given Narcan out in the public setting, and then came in and they had no intention of doing any sort of an opioid. They had smoked marijuana. They were very open about it and were freaking out that they had pretty much, without the assistance of someone using Narcan that had been given out, they would have died. I mean, we know that if you overdose and we don't reverse it, you will die, which is why we give it out. We just throw it around like glitter or confetti around here. And it is having a positive impact on, even if just that one patient, if the 500 doses that we have given out, if that saved one person, not saying that anybody deserves to be saved more than another, but this individual had no clue what they were taking into their body. And this moment in their life was changed. And so, again, whether I was a fan or I wanted to do any of this, it feels really good to be part of a program and an organization that is saving lives. And whatever that takes, I'm happy to keep supporting it. And you're a very big advocate for promoting it in any healthcare setting. So.
Thank you, Becca. The lives changed and saved is just miraculous. Naloxone has been a huge cornerstone of our program, and we have almost like 210 of our participating hospitals in California are actively providing naloxone and saving lives and making that difference out there. It's just sorry, I get touched kind of thinking about all the lives saved. Yeah, well, I'm so glad you all could join us today. I want to open it up. Any final thoughts you'd like to share? Nicole, want to start?
I think that I just love that we've talked about burnout and love that we've talked about the moral fatigue, and I appreciate that you guys have all felt the same way. I do believe that part of the turnover and the staffing issues that we're seeing in healthcare, this is a way to mitigate that. The substance use navigators create a culture where everybody wants to be a part of that team, and there's tons of money. We all know this turnover is extremely expensive, and so is patients who are frustrated with their care. All those things lead to reimbursement and lead to whether or not your department is thriving. And so it's such an integral role of not just managing patients' outcomes, but also creating that culture where the right people want to work for you, and the right people want to be on your team. Hard to quantify, but it's strong. Oh, Josh. Hi, Josh.
Yeah, thanks, Daisy. Josh saying hi in the chat. Josh helps lead our naloxone work along with another program team member, Kaya. Their emails are in the chat, so if you want to reach out with them for any more support and guidance, please do so. Chelsey, any last thoughts?
Just to speak to the continuing benefits of having our navigator as a member of our team. I mean, as we grow as an emergency department, as we bring on new staff, it's just absolutely instrumental in continuing to bring us best practice ideas and to share with us communication resources and to be a true role model for compassionate care. And that lasting impact isn't a one and done. It's literally every interaction that she has enhances somebody else's own personal, toolkit of how to interact with other individuals in the ED, in the inpatient side, in the labor and delivery, throughout our whole hospital. It's been a complete benefit to the entire organization and more importantly to our community.
Thank you, Chelsey. Becca.
I would just follow up. It was brought up a little bit, but the sun really boils over into our mental health population as well, and it is a huge resource. It's not just for nursing, not just for the community. Our providers rely on them, and even continuing to bridge the gap even more. Substance use and mental health often, which came first or which came after is irrelevant if we can address both of those things. And that navigator embedded in the ER and the facility as a whole is really helping to do that. So very thankful for the outcomes that we're seeing related to the right person being in the right spot doing this work in ERs.
Yeah. Thank you, Becca. Thank you, Chelsey. Thank you, Nicole. Thank you so much for sharing your stories with us and, the learnings. We're so grateful to have you part of the team. Oh, yeah, Chelsey.
I did have one more thing
Yeah.
that I forgot to touch on. And another way that the navigator supports our organization and our community, she actually sits on a collaborative meeting that we have with some of our local psychiatric facilities and has been instrumental in breaking down barriers for us discharging psych patients with substance use needs. And it's just been a wonderful voice to have at the table, an advocate for the patients and an advocate for safety and proper medication assisted therapies. And that has been another benefit that I just wanted to call out.
Yeah, thank you. I mean, it's like, you starting conversation with this, talking with folks, the benefits just keep coming. It's so much more than this sort of like helping a patient get into care. We know that's a huge part of it. We know that that's like such an impactful thing for individual patients' lives, but the ripples the navigator can have through the hospital and through the community is so, so profound. So yeah, thank you to our wonderful speakers for joining us today. I would like to give a plug for California Bridge Academy. We'll be sending out a link to this after this event. This is an opportunity for free continuing education units for nurses. We also have free CME courses for your prescribers, and nurses are also able to use those courses when completing for educational purposes. Some great content up there. And yeah, get in touch with us. We want to hear from you. If you have questions or comments, you've got anything you want to share, we'd love to hear from you. Our email, info@bridgetreatment.com, or excuse me, .org. Thank you so much for joining us, and we'll hang for a minute if there's a question or two.
Amy, it looks like there's people with their hands raised. I don't know if there's a way to address that.
Yeah, Aiden, I don't actually see that on my end. Is there someone in particular?
Christine Norwood and Jeff Loft, both, or Jewel Loft, excuse me, both have their hands raised.
Thank you. Yeah, Christine. There we go. Christine, can you come off mute? Hello. Maybe not. Maybe it's a problem. Okay. Well, Christine, if you want to put your question in the chat, we'll watch for that. All right. Yeah. Thank you, Nicole. All right, folks. Well, thank you so much for joining us today. Please send us an email if you have any questions. We'd love to hear from you and can connect with folks. And Larry, your question about CE opportunities for SUD counselors, it depends on your specific certification or license. There is some courses specifically for navigators on the academy as well. So it just depends on your governing body and which certificates or units that they accept. Okay. Thank you all so much for joining us. We'll see you at the next one. Have a great day.